Welcome back to Grip TV. Again, I'm your host, Warren Davis, and I'm here with members of stoAc. That stands for Springfield Township Opioid Action Committee. And they're going to tell us why they're here today, and they're going to tell us all about their organization. So we'll start first with the guest to my right. Introduce yourself and tell us about your organization.
My name is Barb Senst. My husband and I formed this organization a few months after my son died of an overdose, which was last year. And we decided we needed to make Springfield Township much more aware of what is going on with the opioid crisis here. We've struggled with him for many years, and there were just a couple of things that happened when he was taken to the hospital once with an overdose, and then when he died that we think fell through the cracks. And we wanted to make it right. And we also thought it was very, very important to get in and start educating the kids in the high schools, the middle school, and the elementary school, along with the people in the township, about opioids. And a lot of people, you know, their reaction is, this doesn't happen here. And it does happen here. And there have been more than a handful of kids from Springfield Township High School that have overdosed and died from opioids.
But little known, and it's happened over the past probably 5 or 6 years. And there have been, aside from that, all the overdoses that happen. And, you know, we used to call the police and say, right down at the end of our beautiful street, the drug dealer's right down there. They walk around here everywhere. It's very easy to get drugs everywhere. Parents say, where are they getting them from? And they can walk right down the street. They can, you know, walk a few blocks away. They can go right over to Kensington. It's very close. Oh, yeah.
And Bucks County is very close. Norristown is very close, and as Lindsay will attest to, and Eric. A lot is going on here, and people just don't know about it. So that's why we started this committee.
Very interesting. So you said your son passed away.
Yes.
And from an overdose.
Yes.
And you didn't know that he was actually involved in that type of thing, I guess.
We did know.
You did know?
Yes, we did know, and we've been trying to get him help in many ways for years. He was in and out of rehab a few times. But as I say, if I'd known then what I know now, maybe things would have been different. We've found a lot of different resources, a lot of resources with the county we didn't know existed. But at the same time, a lot of things falling through the cracks that need to be fixed.
So now that you've started this organization, does it help you somewhat in a consoling process? Does it help you somewhat helping others?
It gets me through the day a lot of the times. Okay. It does. You know, you never know what's going to happen from one day to the next, and there's always a hole there, and you have to walk around it and figure out it's never going to fill up. But this does help, knowing that hopefully we're going to be helping other people. And one of the things we have said, and people in the township tell us all, that we need to bring what's going on at the state and county level down here. And I think that's what's been missing. So that's what we're trying to do. So
you guys have a definite beef with Big Pharma and stuff like that, with the pharmaceutical companies and the prescription that they're writing for people.
Absolutely. Don't even get me started. I'm really glad that they have to do now electronic prescriptions. There are doctors all over there. There was a 90-year-old doctor that was being allowed to prescribe for Jake. Kids know how to, and adults, they know how to doctor shop. Yes, we're very involved with things like the Opioid Spoon Project, and you know, we put things like that out on our Facebook page all the time so people can have access and look at it. But yes, it's don't even get me started on that.
Okay, we won't get started on that.
The more you know, the bigger it gets.
Absolutely, absolutely. So we're going to come back to you, though. We're not finished with you. We'll come back.
Okay.
So let's go over here to Lindsay. So Lindsay, tell us a little bit how you got involved with stoAc, and what's the situation like up here in Springfield Township?
Absolutely. So my name's Lindsay Santman. I got involved maybe 6 months, about 6 months ago with stoAc. I went to a township meeting, and it was all about the opioid epidemic and how it's affecting Springfield Township. And I've been sober for 6 years almost at this point in January. Thank you.
My audience loves that.
Thank you. And I've always been very concerned about the growing opioid epidemic, and I've always wanted to help in any way I can. So I heard about Barb and everything she was doing, and my mom and I jumped to help. There is a problem in Springfield Township, and I think it's one that goes unnoticed a lot. And I think part of it is because people don't want to acknowledge it. They don't want to think it's here, and it is. I had an overdose about 7 years ago. I overdosed at my house, and thankfully the first responders did have Narcan. I was revived, and that started my recovery journey. But I think the education needs to be worked on. I think our local and community resources need to be worked on. And I think if we work together as a community, we can start supporting and helping these people. And they need it.
Absolutely. So, you're 6 years clean.
Yes.
But you don't look very old at all. No. So you must have started using when you were like early teenager, something like that. Because you don't look much further than a teenager right 26. Now.
Yeah, I'm 26.
26, okay. All right, so that would mean like you've lived up here all the time?
Yeah, I've lived here my whole life.
Okay. So a lot of teenagers are up here using.
Yeah, a lot of teenagers are up here using. I know a lot of people that I graduated high school with that are either currently in recovery or are in and out of recovery. So it's a lot of people.
How does being involved with stoAc help you?
It helps me because it also helps my sobriety. The more, do you want me to hold it? The helping others helps me with my sobriety. It gives me a purpose. I feel that everything I've experienced was for a reason. I'm currently going to school working towards my addiction certification, so it's something I'm planning to continue. And I just love helping people that needed help because people gave me help so freely, and I want to give that back to them too.
Absolutely. So do you think there's enough meetings for addicts up here for recovery, Narcotics Anonymous and things like that? Do you have that up here?
We do. We have a lot more AA than NA, but there are a ton of clubhouses. They're everywhere here. People don't know. And we're trying to get the word out about them.
Okay. Yeah. So getting the word out is real important.
Yes. Mm-hmm.
That's why we're here today, Grip TV. All right, coming over here to our other guest, Mr. Eric. Am I correct? Mr. Eric. Mr. Eric, tell us a little bit about yourself and let us know why you are involved with stoAc.
Hey, my name's Eric DeStefano. I also am in recovery. I got about 6 years also. This is my first time with stoAc. I mean, this is my girlfriend. She's pretty into it, and so guilty by association, I guess. And I definitely support everything they do. And like she said, it does help me stay sober. It keeps it green, as they say. And it does a lot. I think a lot of people don't think it's in the suburbs, and it is. I grew up in Cheltenham, next town over, and it was all over. I mean, it's everywhere. And there's,
so you were pretty young too.
Yeah, I'm a little older.
When you were
I started right out of high school. I mean, I was smoking a lot of weed and doing a lot of other stuff in high school, but I didn't really get into the hard drugs until after. And I was in and out of rehab for about 8 years. I've probably been about 10 rehabs. Okay. And this last one, it just clicked. The meetings really helped me a lot. I was going to like 2-3 meetings a day.
Okay.
So that
if a day, that's good. That's what you need.
Yeah. I wasn't working at the time, so I was able to do that. I was blessed. And like she said, we have a lot of clubhouses in this area.
So people now, you too?
I haven't been going to as much. Like, I've been really busy, and that's why I'm trying to get back into this and try to get involved again, because it's been a little while. And it helps.
That is important.
Mm-hmm. Yeah.
Are you helping people right now? Because people are watching the show. When they watch the show, they hear from you. you know, how you got away from it. Was there one special thing that made you one special event that made you decide I'm not doing it no more?
Not really. Really, it was like I said, I was in and out of rehab, and this time again, it was more just like, here we go again. Let's see how long I could last, because I was only really sober a day or two outside of rehab, and this time I went to a lot of meetings. And I try to give back, grab people that are fresh out of rehab or newcomers, and you know, give out coffee. Anything I could do to give back to the community really helped me out. If I were to name one thing, that would be it.
Very interesting. Thank you very much. I'm interested in what's going on up here in Springfield. So, Barb, can you tell us a little bit about those pamphlets that you're holding? What are those? And you can show each one, like, to our audience.
We made a couple of
one at a time.
Yeah. This one was done before by a wonderful person who lost her son in February. This is all about parent organizations and parent support, which is so important.
And this is called "Is Your Family Affected by Addiction?"
And it goes through and it gives you, every parent organization within, you know, I don't know, 5-10 miles around here, probably even farther, that you can go to and get help. It's so important for parents to know what's going on. And this is all supportive, and it gives you a lot of information too. And people, they've been through this. They've been through the same thing that you've gone through or you're going through. And it's just it's a really great support. It also has on it, along with it, we have basic information in here about what numbers you can call if there's a problem, along with all of the information about the different parent groups. What is addiction? A message from, you know, parents whose children struggle with addiction. And
wow, that's powerful.
I think, yes, and I think one of the most important things is that this is in our other pamphlet too, is if you think there's something wrong, there probably is something wrong. And I think a lot of people just sweep that under the rug, because it's like, yeah, you know, he's probably just having a bad day or this or that. Our second one, this is aimed at kids from like 12 years old. I should say kids up to 25, because obviously I'm older.
And this one is called "Is Your Brother, Sister, Mom, Dad, Friend Affected by Addiction? Here's what you need to know, and here's what you can do."
And one thing we found out is there are a couple interesting things. Again, it's like if you think there's something wrong, there probably is. And always try to do something about it. It doesn't matter. Tell somebody, whatever. One thing many kids told us, and this was with my son and other kids, is they're really good at manipulating a situation and talking about things. And they'll say, you know, if you tell my mom, I'm going to lunch with you, but I'm going somewhere else, I'll never be your friend again. Yeah. And unfortunately, you know, a lot of kids believe it because they're best friends and they're younger, and it doesn't matter. It doesn't matter, because if you don't tell somebody, you lose them anyway, probably. So, you know, you'd rather, you know, work with a kid, tell somebody, let them not be your friend, or they'll be mad at you for a while, but they'll come back. So that was very, very important. Yeah. Yes. And again, the other thing is, if you see something wrong, it's probably there's something wrong with that. So we've got some interesting things in here, and we worked with kids to make this, and it's called do's and don'ts, pretty much. Like, what should you do and what should you not do and not say. And a lot of it is, you know, understand that addiction is a disease, which a lot of people don't understand. Tell somebody. Doesn't matter. Just tell somebody. It could be a parent, a counselor. Walk into the police station. You can call me. You can call Lindsay. You can walk into AA. Tell anybody you want to. Tell the cashier at Giant. It doesn't matter. You know, somebody needs to know about it. Absolutely. You know, you tell the person that you're concerned, and you keep telling them that, and you keep telling them that. There's another thing that's in some cases is in a lot of hospitals. Some work it well, some don't, called warm handoff, where if somebody goes to a hospital, you can say, please start the warm handoff program, and they will work to try to
get that person help. And it's called warm handoff.
Okay.
And Abington Hospital does it. I believe Chestnut Hill is doing it or going to be doing it. A lot of hospitals around here do it. It started up in Reading.
Okay.
And it's been very successful. And they'll get the police involved. They'll get a counselor involved immediately. They'll get the nurses involved, everybody involved to try to get you help while you're at the hospital.
Wow, that's
so
powerful.
somebody now, people can just still walk out and say, I'm not getting help, but they'll give you all the information. A lot of the times, and these are things we're trying to work on now, is to get follow-up on that. Constantly follow up if a person decides to go home and says, I don't want help, but we'll know about it, or someone will know about it, and they'll go knock on the door later and say, this is what we need to help. So
Powerful.
a lot of it,
Real involved.
a lot of it is about, I'm using a new word, and you may have seen around coaxing. You got to kind of coax the person there, because you've got about maybe a 2-minute or 5-minute window where they might have a moment of clarity when they're at the hospital going, oops, I got to go get work, and then you get, really fast to make it happen. Exactly. Or not. But, and then, we go through our do nots, but the most important thing is do not do nothing. So, anyway, so we go through this and recognize the signs of addiction and recognize an opioid overdose. Then we talk a lot about prescription drugs, which is really, really prevalent, especially in the high schools. So it's easy to cut prescription drugs. Probably not. They're making it a little bit more difficult now, but a lot of kids, they take it from their parents' medicine cabinet or their friends, or they'll go out and sell it. So that's a big, huge thing right now that we're working on. Yeah. So there's, as I said, the more you know, the bigger it gets, and it's just. And now, if you go buy drugs off the street, it doesn't matter where. You have to be so careful what you're getting. Fentanyl is in practically everything right now, even marijuana. So, and my son died and he had fentanyl in his system. I think all the overdoses I know the last few years, there's fentanyl in everything. And you have to be so careful because it just takes a tiny amount. So we're
way more powerful than heroin.
Absolutely. And it's like, 50 times more powerful, 50 to 100 more times powerful. And it's really cheap, and they throw it in everything now. So anyway, so that's what we're doing. There's a lot to do. A lot of it is the process. We're working with the police department, who've been wonderful to start some new programs that we're just starting to be able to walk into the police department and say, I need help, and what do we do? And the police will get them help, no questions asked. Wonderful. So things like that we're starting with. They're helping us a lot with some of our grant writing, and we're going to give little cards out that they will actually give to a person that they can fill out very quietly over in the corner and either give back or drop off with their names on it if they want help. So we're doing whatever we can to get people help.
Wonderful.
So,
can you give us contact information, website information, all the kind of information we could put on the screen, so when we show this, the people will know how to get in contact with you?
Absolutely. We have a Facebook page, Springfield Township Opioid Action Committee, which is STOAC 2019. And we also have an Instagram, so come follow us on Instagram. That would be great. We do have it.
Instagram?
It's the same, at stoAc 2019, right? Okay. Same handle. And we're really active on our Facebook page, and it reaches, up to 2,000 people now, which is great. So,
do you have a website?
We do not have a website yet.
It's in the works,
and
I know.
Yeah, well, we're thinking about it. Yeah.
Okay.
We find that people really use Facebook a lot in regards to this, but we'll probably do that, and that we might have Lindsay doing that.
Numbers?
And we do not have a phone number right now because we're not a counseling service, so we provide phone numbers. We do have a Gmail, which is stoac2019@gmail.com.
Okay.
And we tell anybody to please feel free to get a hold of us. And again, all of the information is on our Facebook page. Again, we've decided not to do a phone number yet until we get a little bit farther down the road. So anyway, that's where we're at right now.
Wonderful. Any last words from you guys? You're good?
No. I always have a last word.
Oh, do I?
Yes.
Should I talk about this real
yes,
quick?
talk about that.
Yes, go ahead. Talk about the, what's that, the Narcan?
It is, it's a standing order in Pennsylvania for naloxone. And the reason I decided to make something about this today to hand out is because I was talking to some people at work and they had no idea what I was talking about. So what naloxone, or also known as Narcan, is it's an opioid reversal medication. So if somebody overdoses on any kind of opioid or fentanyl, it is used to revive them. If for any reason you cannot get Narcan or naloxone from your primary care doctor or other medical resource, you can walk into any pharmacy in Pennsylvania and ask them for the standing order, and they will give it to you.
A standing order?
It's a standing order for naloxone.
Free?
If you have government insurance, they do cover the cost. Okay. Cost varies depending on insurance company. It is cheap though. I think it's about $20 to $35 typically.
Okay.
They give you two forms. It's either intranasal or auto inject. It's a very easy medication to use, and they will go through all of the instructions that are provided with the medication for you.
Wonderful.
So it's something I recommend for anybody who is a substance user, anyone who has a family member or loved one who uses opiates. It's a good thing for them to have just in case.
Absolutely. Absolutely.
Yeah.
Anything from you?
Anything for you?
I'm good. I'm good. Thank you.
One more thing?
Yeah, just
Sure.
just to follow up with the Narcan, one thing we do when we're out at events, and we go to every event we can find around here, it doesn't matter what it is,
Okay.
is people we have a suggestion box, and two suggestions keep coming up over and over again. Is more education, and the other one is, can we please have Narcan training? So we're probably going to schedule a Narcan training in January at the Township building here, which will be great.
That's
And so we just want to liberate. Those are the type of things we're doing. So
demonstrations.
yes, I'm sure you have. You're welcome to come up and demonstrate for us if you want.
No,
so
I
there you go.
I can film it for you.
You can film it for us. So those are a couple more things we're doing.
Very good.
Yep.
Very good. Well, thank you all today for the interview. Very informative. I really appreciate it, and I'm glad I'm here today. And I want to wish you the best of luck with everything that you're doing, and I will be praying for you, and so you have a blessing on this organization. So thank you very much, all of you.
Thank you.
Appreciate you. I'm here for you if you need me.
Thank you very much.
Yeah, and for you. Well, folks, that's it from stoAc. Next up, Springfield Township Police Department. So stay tuned.